The theory of chiropractic has evolved over more than 100 years. It began quite simply that the brain is the master organiser. The spinal nerves go from the brain all the way out to the periphery, and in essence the brain is communicating with all the different organs and systems in the body and keeping that functioning in a systematic, harmonious way. What we're also recognising that is with enhanced findings within anatomy and physiology, we're noticing that an adjustment will also, or the delivery of the care can also stimulate the brain in ways that we hadn't thought of when chiropractic care was first discovered. So an adjustment or an intervention at, let's say, a lower back not only helps the lower back, but it also helps the brain's understanding of the lower back, and therefore it is better able to regulate it. And what we find is that this can happen in every part of your body, and it's done through a mechanism called proprioception, which is essentially a little organ that senses stretch. So if you stretch something in your body, your brain knows about it. It's as simple as that. If we look at the human as an interconnected being, and we know that it is, the nervous system dictates that just very simply, a person who has a whole body that functions well is going to be doing better than a person who doesn't. And some simple aspects to that: if you're in pain, you're not going to be functioning as well. If your joints don't have the full range of motion, you're not going to be functioning as well. They'll take energy, they'll wear out faster. So it's those basic concepts. So the chiropractic training in New Zealand has been around since 1994. I was actually one of the first graduates from the college, and it's a 5-year degree. So there's a lot of basic science work in the early years, moving into a strong focus on clinical science and radiology and radiography. So it's a comprehensive 5-year degree that's well-renowned and gives us all the tools we need to function effectively in primary health. So the types of courses that you would have as part of the degree or part of the study in New Zealand will range from, when I say basic sciences, you're talking biochemistry, physics, you're talking anatomy, biology. Then you're starting to go into the human body. We're talking about full spectrum anatomy, physiology, human physiology, embryology, and then we go up another level and we're starting to integrate that with the exam techniques that we're looking for and the health history protocols that we have. So then you're starting to look at pathology and looking to see us using that information that we learnt in those basic sciences and integrating that into a way that we can start to then create a clinical impression or a diagnosis of where a patient is and what their complaint might be. Chiropractic care plays an extremely vital part in primary health care. It is our job to assess the smaller things before they become bigger things. The important aspect is that you're laying hands on a person, you're checking for function, you're checking for tone and neurological activity before somebody actually loses it. The cool thing is though, once you have lost it, we can also help. So it's part of the full spectrum aspect in primary care. Preventive chiropractic is different for everybody. However, there is a process by which we use to find out from a person what their lifestyle's like, what they want to get from their health care using a health history. And with a physical exam, we can really start to judge how well someone's actually adapting to that lifestyle and their environment. So based on the care that we give them, as we progress through the early stages, we can start to deduce whether preventive chiropractic care or wellness chiropractic care is going to be appropriate and at what frequency. And we have top athletes, highly stressed individuals who like to come weekly, and we have others that will come every 3 months or 6 months. And it's not right or wrong, it's about working with the person and the goals they want to achieve. My personal practice is a small country town, and it's relatively conservative, and I would see a general populace all the way from the logger right through to the professional, through to the children and babies, all the way through to the aged. And they all, you know, a lot of them start because they think that chiropractic helps them with pain, but a lot of my patient base is now people that recognise that, you know, regular care helps them to function better out there, and they refer their friends and their family, and it just works like that, and it's great, and it's very rewarding. The Research Centre and Heidi Harvick and Kelly Holt, look, they are doing some world-renowned work there. What she's been able to continue and develop further is a model which quite clearly allows us to, from a basic science perspective, understand what's going on when we're working with people. So if you do an adjustment on the thumb, where does it show up in the brain? Does it have any other effects? Is an adjustment as good as doing exercise? And she's demonstrating using tried and true methods throughout all of science to demonstrate that what chiropractic is doing, that it actually does it.